Astigmatism. Astigmatism, is a typical and by and large treatable blemish in the ebb and flow of your eye that causes obscured distance and close to vision. Astigmatism happens when either the front surface of your eye, cornea, or the focal point, inside your eye, has jumbled bends. Rather than having one bend like a round ball, the surface is egg-formed. This causes obscured vision at all distances. Astigmatism is regularly present upon entering the world and may happen in blend with myopia or farsightedness. Regularly, it's not adequately articulated to require remedial activity. At the point when it is, your treatment choices are restorative focal points or medical procedure. Manifestations. Signs and side effects of astigmatism may include obscured or misshaped vision, eye fatigue or distress, migraines, trouble with night vision, squinting. When to see a specialist. See an eye specialist if your eye manifestations bring down your delight in exercises or meddle with your capacity to perform regular undertakings. An eye specialist can decide if you have astigmatism and, assuming this is the case, how much. The person would then be able to educate you concerning your alternatives to address your vision. Kids and youths. Kids may not understand their vision as hazy, so they should be evaluated for eye illness and have their vision tried by a pediatrician, an ophthalmologist, an optometrist or one more prepared screener at the accompanying ages and stretches. During the infant time frame. At well youngster visits until young. During school years, each 1 to 2 years at well youngster visits, at the eye specialist, or through school or public screenings. Causes. Your eye has two constructions with bended surfaces that twist, refract, light onto the retina, which makes the pictures. The cornea, the reasonable front surface of your eye alongside the tear film. The focal point, a reasonable construction inside your eye that changes shape to help center around close to objects. In a consummately formed eye, every one of these components has a round bend, similar to the outside of a smooth ball. A cornea and focal point with such shape twist, refract, all approaching light similarly to make a pointedly centered picture straight around the retina, at the rear of your eye. A refractive blunder. On the off chance that either your cornea or focal point is egg-molded with two befuddled bends, light beams aren't twisted something very similar, which structures two distinct pictures. These two pictures cover or join and result in obscured vision. Astigmatism is a kind of refractive blunder. Astigmatism happens when your cornea or focal point is bended more steeply one way than in another. You have corneal astigmatism if your cornea has jumbled bends. You have lenticular astigmatism if your focal point has bungled bends. Either sort of astigmatism can cause obscured vision. Obscured vision may happen more one way, either evenly, in an upward direction or askew. Astigmatism might be available from birth, or it might create after an eye injury, infection or medical procedure. Astigmatism isn't caused or aggravated by perusing in helpless light, sitting excessively near the TV or squinting. Other refractive blunders. Astigmatism may happen in blend with other refractive blunders, which include astigmatism, nearsightedness. This happens when your cornea is bended to an extreme or your eye is longer than typical. Rather than being centered definitely around your retina, light is engaged before your retina, causing far-off objects to appear to be hazy. Farsightedness, hyperopia. This happens when your cornea is bended too little or your eye is more limited than ordinary. The impact is something contrary to astigmatism. At the point when your eye is in a casual state, light never goes to an attention on the rear of your eye, making close-by objects appear to be hazy.